One of the stories I remember is this was an urgent care with a primary care and a pediatrics. This was multi-specialty. When they were billing, they were doing a lot of vaccines, but they forgot the administrative code. That's not a big amount, but when you add 24,000, 36,000 vaccines, $10 each can add up. So we were able to go back in time and get them about $350 or $360,000. Don't forget, we can't go back in time forever, timely filing, all that stuff. So we were able to go back and get them a big amount of money. So they were very, very happy. And you do something like that, they're clients for life. When we do the practice analysis, we have a lot of data, but we also have something called observation, what we see, and we also have a plan of action.
Vinny, thank you so much for hopping on today's podcast, and excited to speak to you and learn about the work you are doing at BMW. I am aware you're coming live to us today from the DMV area. I first want to hear about your work that you're doing, but you've been leading MBW, it looks like, for over 15 years now. You've been at this for a while. What is it about this work that continues to motivate you, and how has your focus evolved as the business has grown?
Great question. Thank you, Bert. Thank you for the opportunity. And yes, I've been doing this for a little over 15 years. Seems like a long time, and it is, but I've enjoyed all of it. Couple of things, right? I like to talk to people. And that's one thing, which helps a lot because I do talk to a lot of people every day. The other one is helping people, right? Especially practices. So there's a lot of things that we see that are similar with practices. Many of them have the same issues. And I like to talk to them to understand what issues they're facing, especially in the areas of RCM. And then we try to see, hey, how can we help? Can we alleviate some of their problems, all of their problems? How soon we can do it? That's kind of how we go with it. And that's kept me really motivated. And I love to go and meet all our clients in person. So I travel across the country and meet all of them face to face. It does a few things, right? Brings about the trust, and they kind of open up. Sometimes they don't do it as much on the phone, but if you go meet them in person, they do it. So everything kind of keeps me motivated and focused.
I love that. Who can say busy founders and CEOs like yourself travel to all clients in person? That's unique, And I want to dive into that, the types of clients you're working with today. From what I understand, you work with, private practices across different specialties, from mental health to ortho, pain management. What are the biggest RCM and operations gaps? I know not everyone likes to use the word gaps, but let's call them challenges that you see in those practices today.
Great. So yes, we do work with multiple specialties across the country and multiple softwares, right? EMR and practice management systems. Each state has different rules. We got to work with those. The specialties have different rules, and guidelines. And the EMRs are a little different. So, those are different challenges. But we have a big team, 300 plus people, and each one is good with a few specialties and a few EMRs, right? You cannot be an expert on everything. So we have a team that is really good and all they do is coding. You have another team that only focuses on denials and so on. That's kind of what we do. So we can help a lot of these practices. In terms of gaps or challenges, as you can call it, especially after COVID, we've seen practices have an issue hiring the right people. If they're doing it in-house, RCM, there's a lot of regulations, challenges in healthcare, especially RCM, that changes, lower reimbursements, timely filing, following up with insurance companies, fighting, getting paid, all those things. So we have to, help these practices stay independent and help them, increase their bottom line. That's kind of what we try to do. And there are some common problems and there are some unique problems for each practices, right? So different specialties may have different ones. And so many of the problems, let me just mention a couple of them. So for example, it could be the front office stuff, right? It could be, verification of benefits. It could be prior authorization. Then you have coding issues sometimes. Then we have denials. And there could be a lot of different challenges like that, just following up. They don't have the right people. You just need help to follow up on a few claims and push them to the next level. So we try to help them. And also because I'm on board of two associations, I have other consultants I can lean on to. So you cannot be an expert on everything. So if there is something or a different area that we don't do, the MBW doesn't do, we reach out to them if either it's a third-party tech solution for, let's say, patient collections, or if it's an AI solution, anything like that, we kind of go to them and we try to help them out.
Yeah, right on. I mean, it's clear you support practices within a wide variety of things under the sun of RCM billing. You mentioned coding, denials, AR days. I'm sure there's other areas we didn't even touch on, like credentialing, payer
Of
negotiation.
course.
There's a lot of like RCM companies in the market. What makes your approach different? And like, what kind of results are your
Mhm.
clients seeing?
Absolutely, that's a great question. So I tell people, right, jokingly, that MBW is short form for BMW of medical billing. So that's kind of what I tell people. I mean, I can't put it in writing. I don't think BMW will
Yeah,
like that. But having said that, there are
yeah.
a few things we do differently, right? There are a lot of RCM companies out there, some good, some not so much. And because I'm also with the association like HBMA, I do see a lot of other billing companies, right, across the country. Some are really good, some are not able to fill. Few things that we do differently. One is, like I told you, we actually meet all our clients face to face. That helps a lot. So that helps with the communication. The other thing is we do something called the free practice analysis, and we get into that in a little bit. We have a team called the transition team that is very unique, and not many people have that. And everything new clients go through the transition team.
Mm,
And we document everything that helps us with communication. And if we have attrition later, they are able to help, alleviate any issues. So, for example, when your client starts and goes to the transition team, that team consists of experts from all different departments of RCA, coding, denial management, AR, follow PMs,
mm.
payment posting. So they documented their work on the client, and then they pass it on to the operations teams with KPIs. Hey, this is what you have to meet. And so if we have an operation person leave and there's an attrition, we already have somebody who's done the work, so we can kind of pick it up and stop any issues that may have happened before we can replace them with somebody else, right? So that helps a lot. It also helps with communication. Plus, we also have a standalone quality control team that really helps. And we monitor and track everything that employees do. When we start, we check 100%, then we drop it down to 75, 50, so on. About 15, 20% is randomly checked for everybody, irrespective of what they do. So it could be coding, it could be, NAS, it could be AR. So that's a standalone team. A lot of our employees don't like the quality control team because, that's their whole job is to look and see what they're doing wrong. So that's
Yeah.
kind of what we do. Yeah, so that's kind
Yeah.
of where we're different. And we could talk a little more about the practice analysis when we get to that.
Yeah, definitely. I mean, it sounds like the quality control team is kind of like the RCM police. No one wants to talk to them, but they're necessary,
Yeah,
Like
they're like the internal affairs. That is correct.
internal affairs. Yeah. No, and that's impressive that, you not just like meet clients face to face, but you provide this free practice analysis. You have a transition team that covers the whole gamut of RCM. And yeah, before we get to the free practice analysis, and I've come from this world too of RCM. I worked at RCM teams, and I think what you find, and you might relate to this, is a lot of practices have been doing the same thing for years, especially
Hmm.
around billing and reporting. They either outsource it and they've been doing it that same way, or they insource it, but they've
Correct.
been doing it the same way. What holds them back from changing that? And like, how do you help them move forward from that and enact change?
Can you say that again? But sorry, I just missed that. If you don't mind repeating that.
Yeah, all good. What tends to hold back practices from changing, and how do you help them move forward?
Perfect. So let's step back a little, right? If you talk to any practice, right, many times they're not happy with their EMR and practice management system, and they're also not happy with their current billing solution or RCM solution, even if it's in-house or it's with somebody else. Many times the issue is a lack of communication, or they're not getting the reports they need because doctors are busy, right? They're busy, and there's a lot of administrative burden already put on them, right? So our goal is to make it easy for them, break it down, show easy reports with data, with graphs to say, this is what we did last month. This is what we've collected. Show them improvement of what you've done in month over month, year over year, if you are already working with them for a couple of years, and tell them what you plan to do for the next month and where you see any issues that you might see, right? So if you find a credentialing issue, please let them know. Sometimes you have to try to reach out to them by email, phone, text, because it's not easy to get a hold of a doctor if they need to do something. So usually it's communication. 90% is communication. Same with the EMR companies. In terms of moving, what we generally do is before we start with any client, let's say they want to sign up with us. I'm like, no, they're really happy, great. We want to see if it's the right fit first, right? Because you don't want the client and it's not a good fit for you. So you're not going to do justice to them. It's not good for them. It's not good for us. So we make them sign a business associate agreement, BAA, for a HIPAA compliance, get a login for a day or two, temporary logins, run a bunch of reports, and do something called the free practice analysis. It helps in two ways. One is they may or may not have seen this detailed reports, because that report goes into really detailed stuff, charges versus payments, open AR, denials, any issues that the practice might have, any bottlenecks that they have. So they may or may not have seen it, but we've definitely not seen it. It helps us identify issues and where we can make improvements in the practice. And we can also do resource planning for them before we start. Then we can also have a meaningful conversation with the doctor saying, hey, this is what we see. This is who's currently doing your billing. They have dropped the ball here, or there's an issue in the front office. You have to either hire a new person or train them. And this is not being done. Let's say, if eligibility is not being done, something we can take over. If prior authorization not being done, referrals, timely filing, or they have credentialing issues, or AR is not being followed, anything like that could be one or all of the cases. We understand the practice before we start, then we can have a meaningful conversation, and we can either start on a project basis, per person per month kind of stuff, or take over the full RCM and say, hey, this is the percentage of billing, and this is what we can do for you. And then start slowly, because trust is a big deal, and sometimes they've got burnt in the past, and we tell them that's fine. You don't have to sign a long-term contract. Start for 2-3 months, see what you like. I'll come and meet you after we start working with reports. We'll discuss it and tell us what we can do better, and then if it makes sense, we'll sign a longer-term agreement, and we can take over all of your RCM, part of your RCM, and whatever it makes sense.
Yeah.
That's been really helpful.
Yeah, I mean, it sounds like it's incredibly helpful to do that free practice analysis and kind of get a quick understanding of the issues that their practice has, where the bottlenecks are present. And you said communication is a big part of it. Can you elaborate on the 90% is communication with EMR companies? What does that mean exactly? Yeah.
I mean, not only EMR companies, same with the billing companies. Usually the reason they're not happy is because of lack of communication, because there's a disconnect. So an EMR company is a software, right? So think of it like Excel. Excel can do a lot of different things. Most people use 2 or 3% of its capability, right? Same thing with an EMR practice management system. If it's not customized exactly to what the practice needs, and there's been a lack of communication between the implementation team and the practice, or the billing company in the practice, then that's where usually the problems are. Most of the issues can be solved if there's proper communication. If it's proper analytics and reporting, then we should not have any issues. But generally, that's where the issues, and those can be fixed with, proper communication. So if you start early and do the analysis and show them everything they need, then it's great. That's why when we do the practice analysis, sometimes based on the standard practice, we can go back 6 months. We usually go back a year. So it gives us a lot of visibility to, hey, then it also gives us benchmarks for what we need to do once we start, right? These are the numbers, great. Now that we identified these issues, what can we do better so we can show an improvement or whatever it is, 3%, 5%, 10% from what they have. Now that you have a year's number, our goal is to, exceed that. So you already have a benchmark, which is invaluable.
Yeah. What are some of the indicators from this free practice analysis that you look for, when you're speaking to a new practice?
I'm thinking there's some great indicators. Once we look at it, first we look at charges and payments and the adjustments and see, okay, is it being done? So we get a rough idea of how much they collect, how much they bill. So we understand, okay, this practice collects 100,000 a month, 200,000 a month, 500,000. Then we also know how many resources we need, how to price them. That's one.
Okay.
In terms of the other things, we look at the AR report. So we can see, let's say they have multiple locations, multiple providers. We can see who's their top performing doctor, how many claims they do, who is their leading payer, right? So is it Medicare? Is it Medicaid? Is it Blue Cross? And also when they open AR, we see, okay, these payers, not so much a problem, but Blue Cross is a big issue. 40% of their AR or 120 days is Blue Cross. Okay, that's an issue. Why is that happening there? We can go into it in depth and see that's one. And we can also see, hey, we've got a lot of denials. What are the denials? Is it not submitted on time? Is it, are they not doing verifications correctly? Eligibility not checked? What are the issues for the denials? Same with AR. Is there a trend we can find? What are the patterns we find, and what can we do to resolve this? Some of them are pretty easy fix. Hey, time you filing, great. Make sure everything is done on time. You can solve most of the issues, right? The other one is eligibility or prior authorizations not done. They don't have referrals. They don't have the numbers. They don't have notes in the system. Things like that might take a little more time to fix. Especially if you have to either replace the front office staff or retrain them. That's not a one-day thing, right? That might take a few weeks, a month, depends on how many locations they have and stuff. So we can identify a lot of patterns. And then that's why when we do the practice analysis, we have a lot of data, but we also have something called observation, what we see, and we also have a plan of action. So we say, hey, these are the things we see, these are the bottlenecks, and we think this can be solved by this and this will take about 2-3 weeks, this will take about 2-3 months. And this is your AR currently. I think we can get it down by 10%, 20%, 30%, but it's going to take us 3-4 months based on how big or small the volumes.
I love that. There's data observations and a plan of action, as part of this analysis. So I mean, it's very clear, like from what you described, like the indicators you look for, like AR denials, prior auth, like how do you guys account for the unique, like value-based contracts that certain providers or practices might be under, right? Because when you're talking payer mix, it's not just your traditional health plans that that they see from patients they service and services they render, but also like some of these practices might be in like unique value-based care arrangements. Do you guys touch that as part of your like analysis or the work you've done generally?
Yes, the work we do usually, but we don't usually get involved in the initial stage because that takes already the practice analysis takes us a few days and we do it for free. So that's more an overview of the practice. We don't get into the contracts yet, but we do it once we start. It could be in a couple of months and stuff. So we do have clients with value-based contracts. We do have some clients who have capitation. And we also have clients where we have to renegotiate some contracts because they've done it a few years ago. And we can see that they are getting paid really low compared to everybody else in that zip code or something. So either we can try and negotiate it for them, or like I said, we have some consultants who specifically all they do is contract negotiation. We bring them in and we basically say, hey, these are the experts. This is what we do. We can help you with credentialing, but contract negotiations in the skill center. We possess, but these are the people who can help you take it to the next level. The initial ones are easy to do. If you have a little data, we've done it in the past. But if you really you need some connection stuff, we have other people to do that. So that's kind of how we look at that. That's not something we look at the initial practice analysis stage.
Yeah. What kind of client results are you seeing or have seen? Like any stories come to mind after the practice analysis when you have a new practice come on board? Can you tell us any stories that are salient to you or telling of something that you saw in a specific practice that you guys were able to help ameliorate and then and improve for them?
A lot of stories. So most of them we do see this. RCM is complicated, right? And I think we do a good job. But are we perfect? No, nobody is, right? So there's always something that can be improved with our scene. In these 15 years, I've only seen one practice analysis that I did that they were really good. The AR was really good. There was not much we could do to improve, very little. But almost every other practice analysis we've seen this scope of improvement because, there's only so much time that somebody can do. Either it's a billing company or in-house. They might not follow up on it and the old claims as much as they should. Maybe the front office didn't check on everything. Again, the contracts could be better. The can renegotiations. There's always at least 3-4 areas of improvement in every practice. That's how it usually works. And once we identify that, work on it. Are we successful all the time? No, but if you identify 5, you can solve 4 out of 5. I think that's a good start. And then you slowly increase, right? So if a practice, let's say, is making 100,000, and after 3 months, we can get it up to 105, 110. That's a big amount, right? Because the $10,000 extra a month would be 20-30% of their profits, right? On a monthly basis as possible. And we've seen some stuff like this. We've seen some big credentialing issues. One of the stories I remember is this was the urgent care with the primary care and the pediatrics. This was multi-specialty. When they were billing, they were doing a lot of vaccines, but they forgot the administrative code. That's not a big amount, but when you add 24,000, 36,000 vaccines, $10 each can add up. So we were
Yeah.
able to go back in time and get them about 350 or $360,000. Don't forget, we can't go back in time forever, timely filing, all
Yeah.
that stuff. So we were able to go back and get them a big, big amount of money. So they were very, very happy. And you do something like that, I mean, they fine for life. Unless they sell the practice or something, they
Right.
pretty much they sell it to a hospital, they use for life. So they have been stuff like that. So we have some great references from our clients who have been with us for many, many years, and that really helps. Like meeting the clients, doing something for them that they did not expect, going over and above what they expect, and communications. These are the things we try to accomplish. And that's why we set up a team to be able to do that, right? One person cannot be available all the time. You might be busy doing something else. So we have a whole team, right? So that they know, hey, kids, this person, there are like 4 people who know my practice. This is my main point of contact, but hey, that person is sick today. That's okay. There's another person. If you talk to another person, that really
Nice.
helps to have them pass up.
Yeah. I love that example you just laid out with their urgent care / multi-specialty clinic that you were able to go back in time and help them recover 250 to 360K, billing that they forgot admin codes for vaccines. And, so it's basically like it's helping them correct the mistakes that they've made and correct for any future mistakes, right? Because part of
Correct.
it is like
Correct.
we've certain things in the last 6, 12 months that they might be able to catch. And then let's not make the same mistakes, a year,
Absolutely.
2 year, 3 years down the road, right?
100%. And that could be millions of dollars in the next
Yeah.
few years. Correct.
What do you think is like the biggest blocker? I mean, it's very clear to me the value you guys provide. Like, what do you see as the biggest blocker for practices and practice owners out there that are ready to make a change their RCM? Is it getting their team on board? Is it the whole change management aspect? Like literally just finding the time for their staff to like sit down, review the report and the findings. What is it that you've seen tends to be the biggest like blocker for change there?
Change is difficult, right? They might
Yeah.
have some people who've been with the doctor or the practice for a long time. They like to do things a certain way. Anything different is always tough, right? Change is tough. Most people don't like change. That's usually the problem. But once we can talk to somebody and engage, we basically tell them start slow, right? Our goal is not to replace anybody. Our goal is to help and add value to the practice. How can we do that? That's why we have these two options. Before, most billing companies only do all or nothing, right? They do the full revenue cycle or they don't. In our case, that's why we have two options. We can do the hybrid model. We can help you only with A, B, and C because you already have a team, right? That's great. That gives us a lot of flexibility and say, hey, we can do this on a project basis, see what we do, see the impact we do. And then you can decide, hey, you guys are doing a great job. Can you also do A, B, and C? So that has helped us tremendously. We started doing this about 5, 6 years ago, and that has really helped us a lot. And we have very, very different kinds of clients, right? So we have practices, we have some small hospitals, rural health clinics, QHCs, but we also have some billing companies who want to scale and we kind of help them as a back office. We also work with health tech companies, like RPM companies, remote patient monitoring, CCM, chronic care management, some health tech companies like EMR companies were tech companies, but they need like an RCM back office kind of stuff. So we help them with that. So anybody who needs RCM is something we could kind of help. And we have
Yeah.
very different kinds of clients, not only practices and hospitals.
Yeah, yeah, spot on. I mean, it's beyond just practices. Like you said, rural hospitals, FQHCs, health tech companies, like I think
Mhm.
reimbursement in that area, like I know you mentioned RPM,
Mhm.
CCM, like there is some available CPT code reimbursements for that,
Yes,
but I think
that
that's an
is
area
correct.
that will continue growing as like virtual delivery models expand in healthcare and, we get more technology come into the forefront, so, because
Absolutely, absolutely. Telehealth happened, a lot of mental health practices, especially behavioral health, during COVID, they were able to switch to telehealth. I mean, you can't do that with all practices, obviously, right? You cannot do colonoscopy or endoscopy, remotely. I mean, at least not today. Maybe in the future with AI and robotics, but we talk about that. So telehealth
right.
was a big deal for that. And that's so, there's a lot of different things coming on, including AI and
Yeah.
automation that also impacts RCM. So we either do it ourselves or we partner with a third party and we do that pay for patient stuff for collections. You can't be an expert on everything. So the RCM world is huge. We do what we do well, and everything else we partner with somebody else who we know, we've vetted in the past, and we kind of still maintain the relationship, but the doctor doesn't have to deal with 4 different people now. They just kind of deal with us and we coordinate with the others, be it compliance, anything else that they need.
Yeah. Yeah, no, spot on. I mean, the day we get to reimbursement for things like robotics, I think the day is the day you'll see that explode in in
That
healthcare.
is true. That makes sense.
Nothing has to get done until there's some type of reimbursement incentive or it's mandated by the CMS, of like, hey, do this or you're gonna get penalized, like
Correct.
yeah,
Money, where the money goes is where things happen. That's kind of how it works.
right. And so for like, private practice owners or rural hospital leaders, FQHCs listening, like other administrators, like and they're thinking, this is the type of partner we need, or hey, we're not happy with what we have right now for RCM. What's the best way for them to connect with you and your team online?
Wait. First, look at our website, medicalbillingwholesalers.com. You can reach out to me, Vinod, Vinod at medicalbillingwholesalers.com. That's my email or my LinkedIn. I'm pretty active. You can search for Vinod Sankaran or Vinny Sankaran. You'll find that in LinkedIn. So 3 different ways to reach out. What I would say is start. Doesn't cost anything to talk. Have a call, 15 minutes, 20 minutes. So I understand if it's not the right fit, I'll recommend you to a different RCM company because you're not an expert in everything. And that comes out. I've done that many times. Either there's something that is really specialized and I don't know how to do it, or we don't know how to do it, or they're really small and we don't handle it. I would refer it to somebody else. That's one
Yeah.
option. And the other one is, if it looks like a good fit, I'll tell them, hey, sign a BAA and let me do a free practice analysis and then decide. If you decide to go a different route, no harm done, no foul, no big deal. I'm happy to have helped and I wish you the best of luck.
Yeah. Yeah. Spot on. No, that's amazing that you're like with your expansive network you have, you mentioned you're part of a few boards and associations, like and you advise other RCM companies. I'm sure you're able to recommend them, if
Yes.
given it's not a good fit. So that's very insightful. But yeah, Vinny, it was a pleasure speaking to you today. I'm excited to keep tabs on the journey of the BMW company for RCM, the BMW RCM. I love that
I like that.
analogy. For those listening, there you go. For any practice owners that are ready to upgrade to the BMW or looking to improve how they're doing RCM and operations, this is who you want to reach. So Vinny, it's been a pleasure speaking to you and looking forward to keeping tabs on your journey at MBW.
Thank you so much, Bert. Thank you. It was a pleasure. It was a lot of fun. Thank you.